next presentation that we have on the homeopathy standards. What we looked into were the Ayurveda standards, and now we will touch upon the homeopathy standards, which will be presented by Dr. R Rejikumar, who is the head of the homeopathy. He's the state nodal officer, quality assurance, and medical officer, the higher grade and district convener of the mass media cell. Pathanamit I'm sorry, I'm not getting this right if I'm getting it wrong. And also the Department of Homeopathy, Kerala. Sorry, Dr. Reggie Kumar, I think you can, specify or spell it out for me in a better way. Dr. Reggie Kumar, he's done his BHMS and also Doctor of Homeopathy Medicine from Government Homeopathic Medical College, Thiruvananthapuram in 2000. That was way back in 2009. He's the state nodal officer, quality assurance, medical officer, high grade, and the district convener. And also in the Department of Homeopathy, Government of Kerala. He is the national level external assessor for NQAS, that is National Quality Accreditation Standards, for the public health facilities developed by the National Health Systems Resource Center under the Ministry of Health and Family Welfare, Government of India. He is the principal assessor and faculty member for the accreditation of AYUSH hospitals under NABH QCI New Delhi. Member of the Scientific Advisory Committee, National Homeopathy Research Institute in Mental Health, Kottayam, under the Central Council for Research in Homeopathy, CCRH, Ministry of Ayush, Government of India. So over to you, sir, for the next session on the homeopathy standards.
So warm welcome to all again to the broad world of Ayush in general and homeopathy in particular. I do have my acknowledgements to my department, parent department from Government of Kerala, Department of Homeopathy, as well as the National Ayush Mission. And of course, I am here only because of NABH under the Quality Council of India and also for CAHO for providing such a nice platform for professionals across the globe to get in and collaborate with each other. And this has been discussed in detail by Dr. Indubala, so I am skipping the slide because in the first edition there were homeopathy and Ayurveda standards along with yoga, naturopathy, Unani, Siddha. In second edition, homeopathy and Ayurveda standards were revised and other standards are remaining in the first edition. And the NABH, so basically there will be accreditation standards as well as certification standards, as again explained in detail by my previous speakers, colleagues, Dr. Indu as well as Dr. Shweta also. So now I'll be focusing specifically on the homeopathy standards, and of course, as Dr. Indubala has put, almost all the accreditation standards, they have one thing in common, that is the 10 chapters. And among the accreditation standards, homeopathy has the largest number of standards, in fact, which is 104 standards, and it has the largest exhaustive number of objective elements also, 675. In between, there were some delegates asking about what is the objective element and what is the standard. I think it has been explained in detail, but it's just like standard is a broader thing. We specify points under the standards as objective elements. So it's like a genera species things wherein we come down to the specific points. So this is all again common for the all the systems. There will be patient-centric standards as well as organization-centric standards. Under homeopathy, under the patient-centric standards, under the first chapter AAC, we have 14 standards, 96 objective elements. Under the care of patients, we have 23 standards, 158 objective elements. Management of medication, we have 11 standards, 68 objective elements. Patient rights and education, we have 8 standards, 54 objective elements. Hospital infection control, we have 9 standards and 53 objective elements. Just like that, under management-centric standards or the organization-centric standards, there also we have 5 chapters, among which CQI we have 9 standards and 59 objective elements. It deals with continuous quality improvement. Under ROM, we have 6 standards, 39 objective elements. It's dealing with the management responsibilities. And under FMS, we have the 7 standards and 51 objective elements, wherein we are discussing the facility management and safety. And under HRM, we are having 10 chapters, 10 standards and 52 objective elements dealing with the human resource thing. As well as in IMS chapter, we have 7 standards, 45 objective elements, we'll be discussing on the information management system, and that brings together the 10 chapters in 104 standards and 675 objective elements. There are certain, as Dr. Sweta has in detail gone through all the chapters. I am not going into the details of the chapter because more or less, as Dr. Indubala has clearly pointed out earlier, it's cross-cutting standards and almost objective elements are one and the same and common, except for some peculiarities with each system. And NABH is now trying to even cut down those peculiarities to bring it as a holistic or domain nature generic standards. So basically, after say some years, we'll be getting common standards for hospitals as well as right now we have common standards for clinics as well as entry level certificate. So here, these are some points where homeopathy standards has some peculiarities like homeopathy case management, which is a part of the COP2, that is the care of patient chapter, wherein the different details of homeopathy case taking will be managed, because you may be knowing, most of you may be knowing, as homeopathy is giving more time for the case management. So, and also there you can see the prescribed format also, which is also included in the annexures as the acute case format, chronic case format. So here, NABH usually, or NABH or any other accreditation body, they won't be specifying things, like they will be only giving you a broad idea that it should be as per the law of the land, or it should be as per the accepted principles of practice or accepted guidelines. So here, but in the annexures, we have provided case recording format also, so that the hospitals, the constituent hospitals opting for accreditation, they can have a unified format for case taking as well. That is for acute case as well as chronic case, there are formats. And that was with respect to the full accreditation. Now something about the entry level certification that's also going on, which was also covered in detail by Dr. Indubala. I will only be adding some points. As we have mentioned, we have separate standards for hospital and AYUSH center. The essential difference is that hospital will be having IP and center will not be having IP, it will be having only OPD. And this explanation was also given earlier, like AYUSH center, what it is coming under the Homeopathy Central Council Act, and it should include OPD facilities. All these things have been explained also. So in AYUSH hospital, you can have minimum 5 sanctioned beds. So the essential difference is that in entry level certification, you will be going with either OPD or IPD with almost 5 beds, and full accreditation, it will be more than 10 beds. That is the essential difference that you can take home. And this entry level standards, actually they differ from the other full accreditation standards in a sense that there will be a little bit difference in the chapters. Almost all the chapters we have discussed are there, but there will be a little bit difference between the standards and the objective elements. Because as you can see, sorry, as you can see, it is only 37 standards and 147 objective elements when compared to the homeopathy hospital full accreditation standards, which you have seen that it was having 107 and 675 in this place. Just like that. So AYUSH hospital is 37 and 147. AYUSH center is further a smaller group of standards. Only 29 objective standards are there, 140 objective elements are there. And you can see that there is only 8 chapters, unlike the 10 chapters that you get in the full accreditation standard. So this is the area where NABH is looking for small healthcare organizations or small hospitals who can not afford to have the full accreditation. They can go for the entry level certification in the initial phase. And the fee structure is also being explained, and it is revised from time to time. And the smallest entry level certification for a center, the smallest fee can be up to 11,000 plus GST. And regarding the another project Dr. Indu has mentioned regarding the National AYUSH Mission, AYUSH Health and Wellness Centers entry level certification. So here it is actually with the MOU with the Ministry of AYUSH that they have started. And here, unlike the entry level certification for centers and hospitals, this is further differentiated in terms of the services provided under the uh, Ayushman Bharat scheme or the Pradhan Mantri Jan Arogya Yojana, wherein certain service packages are kept mandatory and certain items are also kept mandatory, like the branding, and there should be the scope of certification, there should be information and signage display, infrastructure and facility management should be there, infection control, quality of care. So you can see that some of these areas are cross-cutting with the full accreditation standards, but there are certain peculiar things like branding, which is peculiar to the entry-level certification under National Ayush Mission for the Ayush Health and Wellness Center. So this standard, these group of standards are also again common irrespective of the system, whether it is for Ayurveda or homeopathy or yoga naturopathy, Unani or Siddha. All these standards are same for the entry-level certification process. And it includes other areas like OPD and patient records, human resource, medicine storage and pharmacy, training, interview of patient community, and also the support services, which almost all areas are very similar to that being covered under the full accreditation. And this has been explained already by Dr. Shweta, so I'm not going into the details. We have three phases of certification roadmap, including planning, implementation, and assessment. And this is in a sense the implementation pyramid, or how we are doing. Like, we start with the national, state level, district or institution level training cascade. We go up with documentation and implementation. We do facility level internal assessment, that is the self assessment. Dr. Sweta was mentioning about the self assessment toolkit, which is also available in the website. So any institution can do a self assessment, just like, without going for any assessment. Prerequisite assessment is not needed for any institution for doing this self assessment. Then they can go for a structural gap closure, they can improve their process and outcome gaps, they can go for a district level external assessment, state level external assessment, and even national level external assessment. Then they can go for further gap closure or corrective action reports and go for an entry level certification. Why I am explaining this, this is the process, or this is actually the framework that we have adopted over the last 6 months by implementing in our state of Kerala, which is called the God's own country. So the take-home message, which I want to reiterate in every quality session, will be like that, and also to my called professional colleagues, is that whatever you do, you document it, and you do only what you have documented, so that this do doc will become a duo. So and that will be a circle which continues your quality journey across any systems. And this is one happy news that I want to share with you all people. With the support of NABH, with the support of Ministry of Ayush, Government of India, we were able to get our 150 centers certified in first phase in one go. And that is part of the national level quality revolution that is actually happening under the Ayushman Bharat scheme with respect to Ayush. And especially out of these 150, almost 80%, almost 70 to 60 to 70% institutions were basically from Ayurveda, yoga, naturopathy, Siddha and Unani. And also this other institutions were homeopathy. And we were celebrating this achievement, and even our health minister has put all these things in a social media platforms as well, and she has given a press release or media coverage telling that Ayush quality is improving in our state as well. Now we are going for another 150 institutions in the second phase, and hopefully by the end of March or April we'll be able to have 300 institutions accredited, like certified. And finally, quality is a journey and it is not a destination. We are continuing our journey to make delight, like surpassing the expectations of our patients and our clients. And due to the positive time, I am limiting my session. Thank you all for patient listening. And if at all there are some doubts, we'll discuss this. Otherwise, we'll take it in the panel discussion. Thank you. Over to you.
Right. Thank you, Dr. Reggie, sir, for the insight, short and brief and sweet and very precise, I would say, as to how to go about with the Ayush, the homeopathy standards as part of the Ayush implementation.